Namaskaram. Today I am going to explain about Ashtang Sutrasthanam, chapter 11, that is Doshadi Vijnaniya Adhyaya. So I am going to start now. Athato Doshadi Vijnaniyam Adhyayam Vyakhyasamaha Itihas Mahu Atre Adev Maharshyaha. We shall now expound the chapter entitled Doshadi Vijnaniya knowledge of doshas and others, thus the Atre and other great sagas. So first I explain about dosha moolam, that is dosha dhatu mala moolam sadadehasya. Acharya Vagbhata said that dosha dhatu mala moolam sadadehasya. Dosha, dhatu and mal are the roots of the body always. Doshas are of two kinds. First is sharira, that is somatic doshas, and second is manasa, means psychiatric. So sharira or somatic doshas are vata, pitta and kapha, and manasa doshas, that is psychiatric doshas, that is rajas and tamas. Dhatus, these are the 7 types of the dhatus, that is rasha, rakta, maunsa, meda, asthi, majja and shukra. So rasa, you can, rasa is plasma, rakta is a blood, and maunsa, muscle, then meda is a fat, asthi is a bone, majja is a bone marrow, and shukra, that is semen, the reproductive tissue in the males, and its counterpart artava, that is ovum in females. So ojas, the essence of the dhatus, is counted as the 8th dhatu. In addition, there are some upadhatus, secondary tissue, then such as lasika, lymph, stanya, breast milk, kandara, that is tendons, sira, dhamani, veins and arteries, vasa, that is muscle fat, and muscle fat that is nerves, tarunasthi, cartilage, etc. Malas, that is waste products, and waste products are purisha, mutra and sweda. Khamala, that is dhatumal, waste products of the tissues, excretions of the eyes, nose, ears of the small and big channels, etc. Kesha, roma, that is hair or on the head of the body, nakha, nails, etc. All these are present in the human body always throughout life. So long as they are normal in their quantity, quality and functions, they maintain the health of the person, and when they become abnormal, they become cause of the diseases. This will be described in the chapter. So now we see functions of normal doshas, that is tang chalaha. Tang means vayu, tang chalaha, in between that vayu, chalaha, utsaha, uchvasa, nishvasa, चेष्टा वेग प्रवर्तनैः सम्यक् गत्या च धातूनां अक्षाणां पाटवेन च अनुगृह्णाति अविकृतः पित्तं पक्ति उष्मदर्शनैः. तो अनुगृह्णाति अविकृतः means vata are the normal doshas. Function of the normal, there is vata dosha. Vata dosha is utsaha, uchvasa, nishvasa, चेष्टा वेग प्रवर्तनैः सम्यक् गत्या च धातूनां पाटवेन च अनुगृह्णाति अविकृतः. Out of them, that is chala, vata in its normal state, protects the body, bestowing enthusiasm, that is energies and desire, eagerness, aspirations and inspiration, all activities of the body, mind and the speech, initiation and also executions of the urges of feces, urine, etc. maintenance of the dhatus, tissues in their normalcy, and proper functioning of the sense organs. So these are the function of vata. Now we go for pitta. Pittam pakti ushma darshanaihi. Chut trut ruchi prabha medha dhi shaurya tanumardavaihi. Pitta in its normal state attends to digestion, maintenance of body, temperature, vision, production of hunger, thirst, appetite, complexions, intelligence, courage, then valor and sharpness of the body. And third is kapha, that is shleshma, stritva, snigdhitva, sandhi, bandha, kshamadhivihi. Shleshma means kapha, confers stability, lubrication, compactness, that is firmness of the joints, horberness, capacity of to withstand or withhold emotions, strain, etc., and such others. Now we saw functions of normal dhatus and malas. Dhatus functions are प्रीणनम, जीवनम, लेपोह, स्नेहो धारण पूर्णैहि, गर्भोत्पादश्च धातूनां श्रेष्ठम कर्म क्रमात् स्मृतम. Nourishing or supplying nutrition, maintenance of life activities in enveloping, that is covering, lubrication, supporting, filing the inside of the bones, and production of the embryo are the important function of the dhatus respectively. These are the 7 dhatus. And now rasa rakta maunsa meda asti majja shukrani dhatavaha means these are the 7 dhatus. And prinanam jivanam lepaha sneho dharana purnaihi garbhotpadascha dhatunam sreshtam karma kramat misritam had been taught. Now malas, function of malas, that is avashtambha purishasya mutrasya kleda vahanam Svedasya kleda vidrutihi. Maintenance of strength of the body is the chief function of feces. Elimination of moisture is of urine, and retention of moisture is of the sweat. So sweat ogara. So now we go through vriddha dosha karma, functions of increased dosha, that is vriddhastu kurute anilaha. Vriddhastu kurute anilaha. कार्श्य, कार्षण्य, उष्ण कामत्व, कंप आनाह शकृत ग्रहान, बल निद्रा इंद्रिय भ्रंश, प्रलाप भ्रमदीनताः. Vata, when increased more than its normal, produces emaciation, black discoloration, desire or hot things, tremors, distension of the abdomen, constipation, loss of strength, sleep and of sensory functions, irrelevant speech, giddiness and timidity are the things. Now we see about Pitta. The Pitta, Pita Vinamutra Netratwak Chutrit Daha Alpanidrataha Pittam. When Pitta increase, produces yellow coloration of the feces, urine, eyes and skin, excess of hunger and thirst, feeling of burning sensation and a very little sleep. Now we see increase of kapha, shleshma, that is shleshma agni sadana prasekalasya gauravam shvetya shaitya shlathangatvam swasakashati nidrataha. When kapha increased, produces debility of digestive activity, excess salivation, lassitude, feeling of heaviness, white coloration, coldness, looseness of the body parts, and dyspnea, cough and excess of sleep. Now we see functions of increased dhatu, that is vriddha dhatu karma. First is rasa. So raso api shleshamavat. Rasa which increase is similar to kapha, like that shvetya, shaitya, shlathangatvam, shvashakashadi nidrataha, agni shadana, prashekalasya gauravam. All these things are happen. Produce the same symptoms of increased kapha. Next is raktam visarpa pliha vidradhina kushtha vatasra pittasra gulmopakushkamalaha vyangagni nasha sammoha raktatong netra mutrataha. Means Rakta, that is blood, when increased, produces visarpa, herpes, disease of the spleen like splenomegaly, etc., abscess, leprosy, and other skin diseases. Then Vata Asra, then it's gout, Vata Rakta, Pitta Asra, bleeding disorders, abdominal tumors, Upakusha, a disease of the teeth, Kamala means a jaundice, Vyanga means a discolored patch of the face, loss of Agni, the digestive activity, Sammoha, this coma, so red coloration of the skin, eyes and urine. So eyes color, urine color and skin color become red in that Rakta Vriddhi Karma. Now we see muscle tissue when increased. What will happen? Mansam Gandarvadam Granthi Gando Rudar Vriddhitaha Kantha Dishwati Mansham Cha means mouse produces enlargement of lymph glands, malignant tumors, that is cancer, etc., increase in size of the cheeks, thighs and abdomen, overgrowth of muscles of the neck and other places. Now we see Meda, fat tissue when increased, Meda Vruddhi, Tadvan Meda Tatha Shramam, Alpe Api Cheshtite Shwasham, Spik Stonodara Lambanam. Fat tissue when increase is also similar, produces the same symptoms, and in addition, it causes fatigue, increased breathing, even after little work, dropping of the buttocks, breast, and abdomen. Now, Asthi Vruddhi Lakshanaha means Asthi Adasthi Dantanscha. Asthi and a bone tissue when increased causes overgrowth of bones and extra teeth. Now we see Majja, marrow when increased. What will happen? Then Majja Netranga Gauravam Parvashu Sthula Mulani Kuryat Krukshansi Arunsicha means Majja produces heaviness of the eyes and the body, increase of size of the body, joints and causes ulcers which are difficult to cure. Now we see when increase of sebum, what will happen? These are the symptoms. Atistri kamatam ruddham shukram shukrashmarimapi. Shukra, when increased, produces great desire for the woman, sexual desire, and even seminal calculi, hardening of the semen. Then now, functions of increased malas, Vruddha, Malakarma, Shakrut, and fishes when increased, then produces enlargement of the abdomen, gargling noise, and feeling of heaviness of the abdomen. That is Kukshvadamanam Atopam Gauravam Vedanam Shakrut. Now we see urine when increased, what will happen? Acharya says, Mutram tu vasti nistodam krute api akrut sangyatam means it produces severe pain in the bladder and feeling of non-elimination even after elimination of urine. Now we see Sweda Vriddhi. Swedo Ati Sweda Dauragandhe Kandu. Swedo Ati Sweda Dauragandhe Kandu. Sweda, sweat when increased, produces excess of perspiration, foul smell and itching. Evam cha lakshayeta दूषिकादीनापि मलाने बाहुल्य गुरुतादिभिः. The increase of dushika, excretion of the eyes, and other waste products are to be understood by nothing their increased quantity, heaviness of their sight, and such other symptoms. Now we see decrease of the doshas. Kshaya doshadi karma. Vata kshinata, vata kshaya. लिंगम क्षीणे अनिले अंगस्य सादो अल्पम भाषिते हितम संज्ञा मोहस्तथा श्लेष्म वृद्ध इक्तावय संभवाः. The symptoms of vata when decreased are debility of the body. The person speaks very little and does very little activity physical. Loss of sensation means awareness and of consciousness and occurrence of all the symptoms of increased kapha. See, pitte mando analaha shitam prabhahani. Decrease of pitta produces weakness of digestive activity, coldness and loss of luster, that is complexion. Now, kafe brahma, shleshma shayanam shunyattam, shlatha dravaha, shladashanditaha, rudravaha shladashanditaha means kafe brahma, decrease of kapha causing dizziness, brahma, emptiness of the organs of kapha, shleshmaya shayanam shunyattam, rudravaha, tremors of the heart or palpitations, and shladashanditaha means looseness of the joints. Now, rase roksham sramaha shosho glanihi shabda ashahishnutaha. Decrease of rasa produces dryness, fatigue, emaciation, exhaustion, even without any work, and inability to bear with noise. And raktadhatu, rakte amla shishira priti, shira shaithilya rukshataha. Decrease of rakta produces desire for sore and cold things, loss of tension of veins and arteries and dryness. Then mansa, decrease of mansa causes debility of sense organs. Mansa akshaglani ganda speaks shushkata shandhi vedanaha. Decrease of mansa causes debility of the sense organs, emaciation of cheeks, buttocks and pain in the joints. Then medadhatu, medasi swapnam katyaha plinno vriddhi krushangataha. Decrease of meda causes loss of sensation in the waist, enlargement of spleen and emaciation of the body. Asthi dhatu, asthini asthitodaha shadanam danta keshanakadeshu. Decrease of asthi causes pain in the joints, falling off of the teeth, hairs, nails, etc. And majjadhatu, asthanam majjani shaushirya brahmaha timira darshanam. Decrease of majjadhatu produces hollowness of the bones inside, giddiness and seeing of darkness, that is blindness. Now Shukra dhatu kshaya lakshanaha, Shukre chirat prashiccheta, Shukram shonitamewa, Dodo atyartham vrishadayoho, Medram dhumayati ucha. Decrease of Shukra dhatu give rise to delay in ejaculation. Ejaculation accompanied with bleeding, severe pain in the testicles, and a feeling of hot fumes coming out of the urethra. Now, Purisha Kshaya. The Purisha Kshaya symptoms are decreased when the Purisha decrease gives rise to movement of air inside the intestines. That is, Purishe Vayu Antrani Shashabdo Vestyanyu. Kuksho Brahmati Yati Urdham Rutaparshe Pideyan Brisham means noise when accompanied by gurgling noise coming of words and causing severe discomfort in the region of the heart on the flanks. Now, Mutre Alpam Mutret Krukshad Vivaranam Sha Asramevucha. Wow. Decrease of Mutra gives rise to scanty urine, dysuria, urine discolored mixed with blood. And Sweda, decrease of Sweda means Swede Romachutihi Stabdha Romata Sputanam Tvachaha. Decrease of Sweda leads to falling of hair, stiffness of hair, and cracking of the skin. So, Malanam Ati Sukshmanam Durlaksham Lakshaytakshayam Swamalayana Sanshosha Toda Shunyattulagavaihi. Decrease of Mala, which are of little quantity and difficult to perceive. It should be inferred from the dryness, pricking pain, emptiness and tightness of their sides or production and elimination. Now we see Doshadinam Yathaswamcha Vidyata Vruddhikshayo Vishak Kshayena Pipiritanam Gudanam Vardhanenecha Vruddhi Malanam Sangacha Kshayam Chati Vishargataha. The increase and decrease of the doshas and others can be understood by decrease of their opposite qualities and increase of similar qualities respectively. The increase of the malas by their non-elimination out of the body and their decrease by too much of elimination. So, malochitutvat dehasya kshayo vruddhastu pidanaha, body being accustomed to accumulation of waste products, their decrease is more troublesome to it than their increase. So far, were described the troublesome signs and symptoms caused by the increase and decrease of the doshas, dhatus and malas. Both increase and decrease are abnormal, that is Vaishamya. Hence, the two terms Vriddhi and Kshaya are used to denote abnormality only in majority of the context. But while describing the properties of certain medicinal formula, the term Vriddhi is used to denote even the normal growth of the dosha, dhatu, and malas, which is wrong strictly speaking. The appropriate terms to describe normal increase and decrease are upachay and apachay respectively. Now we see treatment of increased doshas, that is vruddha doshadi chikitsa. तत्र अस्थिनि स्थितो वायुः पित्तं तु श्वेतरक्तयोः श्लेष्मा शेषेषु तेनेषाम् आश्रयेणाम् इतः यदेकस्य तदन्नस्य वर्धनक्षपण औषधम् अस्थि मारुतयोः नैवम्. In the asthi, means bones, resides vayu and vata. In the sweat and rakta, blood, resides pitta. And in the remaining dhatus and malas, tissues and waste, resides sleshma, that is kapha, in intimate relation of the ashraya, residence, and ashrayi, that is resident, respectively. The medicines, therapies which cause the increase and decrease of one also cause increase and decrease of the other respectively, except in the care of asti and vata. So now, प्रायो वृद्धि ही तर्पणात् श्लेष्मणा अनुगता तस्मात् संक्षयः तत् विपर्यात् वायुना अनुगतो अस्माच्चा वृद्धि क्षय समुद्भवान् विकारान् साधयेत् शीघ्रं क्रमात् लंघन भृंगणैः वायोः अन्यत्र तद्नास्तु तैः एव उत्क्रमयोजितैः. The increase of dosha, dhatus and malas is usually due to tarpana, means more of nutrition, which is followed later or with increase of shleshma, means a kapha, whereas the decrease of dosha, dhatu and mala is due to loss of nutrition, which is followed later with increase of vayu or vata. Hence, the disease arising from increase and decrease of the residence, means a container, the resident, that is content, should be treated quickly by adopting langana therapy causing thinning of the body, reducing the quantity, and brahmana therapy, that is therapy causing stoutening the body or increasing the quantity, etc. methods respectively. In case of vayu, by the other way, its disease treated with the same therapies but in the opposite order, increase of vata by adopting brahmana therapy and its decrease by adopting langana therapy. Now, we see the chikitsa of dhatus. तो विशेषाद रक्त वृद्युत्थान रक्त श्रुति विरेचनैः मौंक्ष वृद्धि क्षयान रोगान शस्त्र क्षाराग्नि कर्म भी स्थौल्य कार्शोपचारेण मेदोजान अस्ति संशयात जातान क्षीर घृतैः तिक्त संयुक्तैः वस्तिभिस्तथा विडवृद्धि जानति शारक्रियया विक्षयोद्भवान मेष अजमद्य कुलमाश यवमाश द्वयादिभिः मूत्रवृद्धि क्षयोत्थांश्च मेह कृक्ष चिकित्सयाः व्यायाम अभ्यंजन स्वेदमद्दैः स्वेदक्षयो भवान. In particular, the disease arising from the increase of rakta should be treated with bloodletting, that is rakta sruti virechanaih, and purgation. The disease of increase of mons by use of sharp instrument, that is surgery, mons vruddhi bhavan rogan shastra kshar agni karvevi, causative alkalis and fire cautery. Those of the increase of meda by therapies indicated for obesity, and it decreases that by therapy indicated for emaciation, that is meda jana asthi sanstholik arshopacharane meda janastak sanchada. To decreases by asti by enema therapy using milk, ghee, and bitters, means bitter drugs. Those arising from increase of vita, means the fishes, by therapies indicated in diarrhea. Those from decrease of feces by the use of abdominal viscera of ram or goat, half steamed pulses, barley, and the two varieties of maas, etc. as a food. So, Those arising from increase and decrease of a mutra, that is urine, by adopting treatment indicated for diabetes and dysuria respectively. Those arising from decrease of sweda by adopting physical exercise, oil bath, sedation therapy, and the use of wine. Now we see about Kayagni. Kayagni means digestive fire or digestive activities present in its own place, has portions of itself present in the dhatus, tissues also. Their decrease in quantity, quality, or function and increase in quantity, quality, or functions give rise to increase and decrease of the dhatu. Means स्वस्थानस्तस्य कायाग्नेः अंशां धातुषु संश्रिताः तेषां शादाति दीप्तिभ्यां धातुरुद्दिक्षोद्भवाः पूर्वो धातुः परं कुर्याद वृद्धः क्षीणश्च तद्विदम्. Means the proceedings dhatu which is either increase or decrease gives rise to the succeeding dhatu on the same condition. Dhatu dushta dhatu karma means function of vitiated doshas. दोषा दुष्टा रशैः धातून् दूषयन्ति उभये मलान् अधोद्वे सप्तशिरसि खानि स्वेद वहानि च मला मलायनानि स्युः यथाश्वं तेषु गदाः. The doshas which are vitiated become abnormal, undergoing either vruddhi or increase or akshaya or decrease. Cause vitiation of the rasa and other dhatus, that is tissues. Next, both of them doshas and dhatus together vitiate the malas, means waste products, which in turn vitiate the malayanan, means channels of their elimination, which are two below, 7 in the 2 below, adhodve saptashirasi, 7 in the head, and khani sweda vahanicha, means and the channels of sweat from these vitiated channels develop their connected diseases. Now we see about oja, the essence of dhatus. तो ओजस्तु तेजो धातूनां शुक्रांतानां परम स्मृतम हृदयस्थम अपि व्यापी देह स्थिति निबंधनम स्निग्धम सोमात्मकम शुद्धम ईशत लोहित सपीतकम यत्नासे नियतम नाशो यस्मिन् तिष्ठति तिष्ठति निष्पद्यन्ते यतो भावाः विविधा देहि संश्रयाः. ओज is the sara, essence of the dhatus ending with shukra. They are reproductive tissues. Though located in the hridaya, it pervades all over the body and controls the working of the body. It is viscous, is anactus or greasy, somatmaka, that is preponderant in up bhuta or a watery principle, clear, that is transparent, slight reddish, yellow in color by its loss, destructions or absence, the loss of body even of life is sure. So to happen and to produce body are sure to survive. From it are brought about the different states concerned with the body. Then when the ojakshaya, ojaha kshet kopa shuddhyana shoka sramadivih vibheti durbalo abhikshanam dhyayati vyatitendriya दुःछायो दुर्मना रुक्षो भवित छामश्च तच्छये जीवनीय औषध क्षीर रसाद्याः तत्र भेषजम. Ojas undergoes decrease in quantity by anger, hunger, worry, grief, excretions, exertion, etc. Which with such a decrease the person becomes fretful, debilitated, worries much again and again without apparent reason, feels discomfort in the sense organs, develops bad complexions, bad mentations, and dryness. The treatment for it is the use of drugs of Jivaniyagana, that is milk, meat, juice, etc. Now we see Ozo Bruddho hi dehasya tushti pushti valodaya. Increase of ojas make for contentment, nourishment of the body and increase of strength. यदन्नं द्वेष्टि यद्यपि प्रार्थयेता विरोधितु तत्तत् त्यजन् समश्नश्च तौ वृद्धिक्षयो भवेत् जयेत. The increase and decrease of the dosha should be controlled by avoidance and indulgence of foods which are disliked and desired respectively, if such food are not unsuitable. Now we see the doshas which have undergone increase and decrease generally produce desires for food which are dissimilar and similar in properties to those of the doshas respectively. Means कुर्वते हि रुचिं दोषाः विपरीत समानयोः वृद्धाः क्षीणाश्च भूयिष्ठं लक्षयन्ति बुधास्तुतः. The unintelligent person, patient and physician do not recognize them. So, yatha balam yathashvam cha dosha vruddha vitanvate rupani jahati kshedaha samaha swam karma kurvate. The doshas, when increased, produce their respective features, signs and symptoms, depending upon their strength. When decreased, cast off, do not produce signs and symptoms, and when normal, they attend to their normal functions. So we see या एव देहस्य समाविवृद्धयि ता एव दोषा विषमावधाय यस्माद् तस्ते उतच्चरेव क्षयाद् विवृद्धिरो रक्षणीयाः. The very same dosas which when normal are the causes for the healthy growth of the body become the causes for its destruction when abnormal. Hence the adopting suitable measures, foods, activities, etc., the body should be protected from their decrease just as from their increase. Now, thus ends of the chapter called Doshadi Vijnaniya, the 11th in the Sutrasthanam of Ashtang Samhita of Srimad Bhagavata, son of Srimad Vaidyapati Singhagupta. Iti Sri Vaidyapati Singhagupta Shunu Srimad Bhagavat Virachitayam Ashtang Samhitayam Sutrasthane Doshadi Vijnaniyam Ekadasha Adhyaya. I am Professor Dr. Brajesh Mishra, working as a professor and head Department of Basic Principles of Ayurveda at Shri Ayurved Mahavidyalaya, Nagpur, Maharashtra, Bharat. And I'm also working as a Vice Principal Administration of this college. And I'm grateful to talk with you on first day of my first lecture. And today is 20th April 2023. So wish you all good night and have a good day. नमस्कार, जय हिंद, जय भारत, जय आयुर्वेद.